All right, I think I'll begin. I'll ask Dr. Goldfeld to unmute herself so she'll be ready to go. And again, good morning, good afternoon, good evening, depending on the time zone you're in today. And I want to thank you for joining us today for this Life Course Research Network webinar made possible by funding from the Maternal and Child Health Bureau. I'm Neil Halpin. I'm the director of the UCLA Center for Healthier Children, Families, and Communities, and professor of pediatrics, public health, and public policy here at UCLA. We're excited to kick off our third webinar in our series, Measuring Development of Children and Youth, building on the first two that we had, the first on the EDI and how it's been used primarily in Canada, and as part of a developing measurement system that's being developed in Canada. And then the last webinar was about the EDI's use in the US with lots of examples from specific communities. And again, for those of you who are joining us for the first time, those webinars are archived on our LCRN website, and you can have access to them and can share them with your friends and family. They make good gifts for Christmas and various things. So today, our webinar features Professor Sharon Goldfeld, who's Deputy Director of the Center for Community Child Health at the Royal Children's Hospital in Melbourne, and is a co-group leader of policy equity at the Murdoch Children's Research Institute. I've known Sharon for over 2 decades now, and had the great pleasure of working with her on a whole variety of different projects, including on the work that's going on the EDI there in Australia, as well as very other things. Sharon has a decade or more of experience in state government as a senior policymaker in health and education, and her research focuses on policy solutions that eliminate inequities for Australia's children. She led the initial trialing and national implementation of the EDI in Australia. And so she's going to be talking about that experience in Australia and what they've learned, where they've been, where they're at, and what it all means. Just a few technical comments before we begin. During the presentation, all participants will be muted. But as a precaution, please be sure that your phone or microphone is in mute mode. Following the presentation, we will have a follow-up discussion Q&A. Dr. Goldfeld's presentation should be about 40 minutes, and that should leave us a good half hour to have discussion. So please key up your questions as we go along and think about what you would like to discuss. If you'd like to submit a question, please do so using the chat function, and we'll read it out loud. We apologize in advance if we don't have enough time to get to everyone's questions, but I'm sure we'll have a lively discussion. If we experience any technical difficulties during the broadcast, please let us know by using the chat function or by emailing us at lcrn@lcrn.net. And a member of our staff will do their best to assist you. So without further ado, let me turn it over to Sharon Goldfeld in Australia. In case you wonder, it's 8 a.m. there in Australia tomorrow.
Good morning, good evening, good afternoon, everybody. Thank you very much for this opportunity. It's a slightly strange thing to be sort of doing this presentation. I'm doing it in my study here. I'm looking at this screen. I can see myself and I can see Neil and Whitney. So it's kind of like I'm just talking to Neil and Whitney, really. So hopefully this all makes sense. And I'm really pleased to be able to talk about the EDI in Australia. What you'll find is I'll flip between the Early Development Instrument, the EDI, and the Australian Early Development Instrument and the Australian Early Development Census, which is a longer story, but hopefully it all kind of makes sense. You can see the title is Changing the Social Discourse on Early Childhood. And when we set out and did all the planning and the kind of risks planning, we put up this kind of opportunity risk about changing the social discourse on early childhood. And I think we can comfortably say that that's exactly what we've done. So let me just start. This is just for those of you who are not in Australia. These are some icons that you'll all recognise for Australia. This is the Opera House. I think always part of our job is to try and flog our country so people come, you know, it's far away, try and add a bit of to the economy. So this is the Opera House. This is the Great Barrier Reef. You should come before it disappears. This is the Royal Children's Hospital. This has actually won architectural awards. If you come, I promise to show you around. A brief little, you know, fun fact. We have a huge fish tank that now isn't able to be used because the glass has exploded in hospitals around the world. So that's one fun fact. And the other fun fact here is our little meerkats. We have a meerkat exhibition within the hospital itself. So if you come, you don't get to see the fish tank, but you do get to see the meerkats. I think that's pretty exciting for people to come for, but more importantly is trying to work out how we can make a difference for children in Australia. And when I give these presentations, I always start with this quote. It's from a book that's written by Australian authors and says that a society that is good to children is one with the smallest possible inequalities for children, with the vast majority of them having the same opportunities from birth for health, education, inclusion and participation. And the reason I start with that, and it's to really anchor both this talk itself, but to anchor all our work, I think, is that the reason we're doing data like the EDI is really fundamentally to drive system change towards a more equal society for children. So many of you may be clinicians. I certainly am a clinician. And as a clinician, we spend a lot of time thinking about the N of 1. And that's obviously a really important anchor for us. But actually what we know from a policy point of view, the challenge for us is the N of many. And how do we actually keep populations of children healthy and developing well? And in fact, it's that question that has really driven the whole reason why we have the EDI. So today I kind of want to briefly run through 5 things. First of all, a little bit about the data and policy context, because the EDI came about at a certain point in time and could probably not come around at another point in time. A bit about the EDI in Australia. I want to tell you a little bit about how the EDI tells the story of children in Australia, geographic and service inequities, and just touching on how we've used the EDI to change the way we think about place for children. So just starting with the data and policy context, it was really the understanding by policymakers about the importance of early childhood development that really kind of piqued their interest in having a measure at all. And it was 2 kind of big facts. One is that we know that the problems for adults actually have their roots in early childhood. And you can see on this slide all of those sorts of conditions. And for those of you who work in this area, this is nothing new to you. We know that adult chronic disease and the kind of tsunami of chronic disease that's been heading into the adult healthcare system really has its roots in early childhood. And the second is, and this slide's now very famous, and it's by James Heckman, who's the Nobel Prize-winning economist, and it turns out that politicians and policymakers listen to Nobel Prize-winning economists, and in Australia certainly his work had a huge amount of impact and really showing that the importance of the rate of return on investment in investing early, and in particular in early childhood. And it's really those 2 facts that drove our ability to be able to insert something about the importance of early childhood into the policy environment. The thing that complemented that is our understanding the importance of data in driving sustainable policy. And I've used this, I was a Harkness Fellow in healthcare policy and was very taken by the work of Kingdon, now a little bit old, but talking about this idea of the 3 elements of how to keep a policy window open for children, and sort of thinking in that sort of longer term. And the first he talks about is this kind of political imperative, which I've already alluded to. The second is recognition of the problem, which is really about data. And the third, and I think probably the most challenging for those of us working in the field is the identification of the solution through policy. And that's kind of beyond the scope of the talk today, but I will hint at it, this idea of how do we offer policy solutions to policymakers once we put data on the table. And if we get a chance to talk about it, I can talk about some of the challenges of providing data at this scale without necessarily the pointed solutions. So in Australia, and this is kind of a brief little sort of journey through Australian politics, but the Council of Australian Governments is actually the heads of each of the states. Australia is made up of a number of states and territories, and they together can put forward rather large policy agendas. And they put together a human capital reform agenda in 2006, and embedded with that this idea that what was then the AEDI, Australian Early Development Instrument, is a national progress measure of early childhood development, which was the first big win for us. And the second was this set of headline indicators for Australia's children, where the nation was saying, these are the important things we should monitor for children. And you can see there's a number of them there, there's 19, but the most important one was this one, which is the transition to primary school. And in fact, our ability then to say that the EDI, which is the Australian Early Development Index, in the proportion of children entering school with the basic skills for life and learning. And so that already anchored the AEDI within the entire national policy context in one fell swoop. And it was a really strategic move. And as I said, it was a moment in time when most of the states and territories were actually our Labor government, which is our non-conservative government, and we were able to get this through, and there was a commitment that the EDI would be national. Just as a kind of fast forward movement, that was back in 2006. This is just from 2018, but just so you know, children's headline indicators still exist, which is pretty exciting. You can go on now and have a look at any of them on the Australian Children's Headline Indicators website. And there it is, transition to primary school. So really now we're talking about 13 years later, the AEDI and the EDI is fundamentally embedded in the policy fabric in this country. So let's go back a little bit to the beginning, and I just want to start by acknowledging the foundational members of the EDI, Dan Offord, who sadly passed away, Magdalena Janus, who's leading the EDI effort now, Clyde Hertzman also sadly passed away, and Joanne Schroeder were really, for us, the fundamental drivers of the EDI in Australia. And then in Australia itself, you'll see a whole range of people there, and Sally Brinkman, Fiona, Sven and Steve were part of the Telethon Institute, now the Telethon Kids Institute, and in partnership with us, we really drove the initial work of getting up the EDI. So the EDI is, and the AEDI, and what is now the AEDC, so the Australian Early Development Census, and it's too early in the morning to drink alcohol, but you know, if we ever get together, we'll have a drink about how that change happened. But essentially, it's exactly as you know it as the EDI. It's a relative population measure of young children developing in Australian communities, and in Australia, it's completed by teachers on every single child starting school in their first year of full-time schooling. These are domains of the EDI. I'm not going to spend time on that. You already would know that. But just a little potted history. The EDI was a little study in North Metropolitan Perth that was led by Sally Brinkman and Brett Hart. And then in 2003, in the kind of wake of this increasing interest in early childhood development and this increasing interest in place as a mechanism for change, we had a meeting to talk about, wow, should we put up a population measure or should we put up an individual measure that we just aggregated up? And there was this incredible resounding endorsement for a population measure of early childhood development. And that's where the journey really started, where we had a piloting of the AEDI for 40,000 kids in 60 communities. And then actually we had this moment when it was endorsed by COAG and then funded politically. There was a moment to be careful what you wish for. In November 2007, we went from the promise of 60 communities to an entire national rollout by May of 2009, which was an incredible scale up for us. But probably that last dot point is the amazing success story for the EDI in Australia, where we're now have just completed our 4th census. So over 1 million children now in Australia have had the EDI completed about them. And we now have ongoing commitment for every 3 years. So having early childhood development measure embedded in the policy fabric of a country, I think is a fundamental game changer. And I'll talk a little bit about our findings, but I think the challenge for us is whether we can deliver on the promise of having those sort of data. So the EDI is completed every 3 years. It's collected entirely electronically via a national secure web-based system. And probably the other big important bit, and maybe of interest to those of you not from Australia, is that there is actual funding for teacher backfill. So teachers are either paid in small regional towns or actually have backfill for the time taken. And without that, there is no possible way that we'd be able to do the EDI. It's a bit dark, didn't it? And of course, like the EDI, everywhere the data are analysed and reported based on where children live. And just a bit of a snapshot of Australia's children. These are the old data, but I wanted to give you a sense. So you know this is the map of Australia clearly. And as you can see, these are the kind of populations that we're talking about. So we essentially cover almost 98% of the whole population. And I'll show you the data over time. And you can just basically see that most children live on the eastern seaboard of Australia and in Queensland, New South Wales and Victoria, and that Australia is a very large country. It's about the size of the United States, but there's only about 24 million people that live in Australia, and most live on the outer edges of it. These are the national numbers. You can see here just up the top here and our national completion rates, and you can see that basically for every census, and the 2018 data haven't quite come out yet, but for every single census, there has actually been a huge completion rate. And then you can see the state numbers there. And just to give you a sense, this is the sort of old data, but you can see the level of scale with 15,500 teachers from 7,500 schools. And we did some initial early work on how people found the teachers found it, and they all found it pretty easy to complete. I think this number down the bottom has been an increase in challenge for us, is how to use the ADI and the ADC to actually connect teachers better with their community and have an understanding. And I think these are a bit old, these data, but if we did it again, we'd see a really substantial shift in the understanding between education and their communities that they're actually existing in. And I'm going to flick through these slides pretty quickly. These are all available on the web through the national website, but you can sort of see over time the level of kind of static numbers that we're seeing here, exactly as you'd expect. But just a little bit here, we can see for Indigenous children, this is a big deal for Australia. This is the largest data repository of Aboriginal children. One of the beauties of a census is that we get these fabulous subpopulations. So Aboriginal children make up a very small proportion of Australian children. And here also this idea of the language background other than children, a small number of children who don't speak English, but this rather larger number of children who are proficient in English and are bilingual. And we'll touch on that a little bit later on. And this is probably a little bit titchy on your screen, but you can see the sort of sample down here. These are each of the domains for each of the years. And there's some interesting sort of gains that we've had. This is 2015, the proportion of children developmentally vulnerable, the green, and the red, the proportion of children on track, and the red is the proportion of children developmentally vulnerable over time. And you can see this is 9, 12 and 15, that particularly around language have had some substantial gains, which is worth noting. And down here, the children, right down here, the children who are developmentally vulnerable on one or more. This is 2009, 12 and 15 going up. So you can see between 9 and 12, we actually had some gains, and then it's been static. And I don't think much has changed in 2018, but I haven't seen the official figures. So this is the kind of national view, and you can see as a national view, you can sort of see, well, that's kind of interesting, but it's a bit blunt. But later on, you'll see some of the ability to show small level data and therefore the precision that the EDI allows us at the local level. So I want to tell you a little bit about how EDI tells the story of children in Australia. So you remember we started with this idea of how do we keep populations of children healthy and developing well. And I want to layer on that this other quote from James Heckman. and remind us that really we're looking at a point in time, and that once a child falls behind, he or she is likely to remain behind. Impoverished early environments are powerful predictors of adult failure on a number of social and economic dimensions. So essentially, we're starting to talk about what are the kind of potential policy levers and what do we need to understand about children so we can think about those policy levers if in fact we are going to make a difference to those environments. Another little plug, much of this research that I'm about to present to you is being undertaken by our research team. There you can see we've got a little baby. We've now subsequently had another 3 babies. So if nothing else, we've at least made a difference to the Australian population. So I want to run through a few areas we've been using the EDI. The first is mental health competence. We've actually created a positive mental health measure. One of the real challenges, and for those of you working with the EDI, you'll know this, is that there's been quite a little bit of pushback because we're measuring children around developmental vulnerability, and where's the positive story in that? And in fact, what we're finding now is that we can use that positive story in looking at mental health competence. And this idea of the dual continuum of mental health. So we can look at mental health difficulties as being high and low, or mental health competence being high and low. We've created this out of the EDI itself. And what we find is we've got kind of these profiles of mental health where you can have high competence and high difficulties, or here, low competence and low difficulties. And what's really interesting, and you'll see it in this paper down here, is it looks like competence is actually driving academic outcomes for children. So even if you're up here and you have, down here, sorry, and you have low difficulties, low mental health problems, if you have low competence, you won't do as well as these kids up here who have high competence and low difficulties. So just a reminder that we can invent with the EDI to tell us some really interesting stories. The second area I want to talk about is children with additional health and developmental needs. And this is a really important story. And this is probably the most important story that we've been trying to focus on. These kids who have, in particular here, this 17% of kids who have emerging needs. On the EDI for us, we're able to ask teachers, is there a bunch of kids that you're worried about that need an assessment around a whole range of issues? And this is the group of children that don't have established what we call special needs. They don't have an established disability that we understand, but teachers are worried about them. These are massive numbers of kids here in Australia, and you can see it's about 1 in 5. And not surprisingly, this is looking over our 3 cohorts, incredibly stable. So this is these numbers here, here, here. 1 in 5 kids across the nation have got these emerging needs. And then when we look at these children, particularly I want you to look at these kids here and how they're doing at grade 3, which is this is our national reading score. You can see compared to the standard population, these kids are doing worse. These are not kids with recognised disabilities. These are kids where the teachers are saying, these kids have come in with no diagnosis, but I'm worried about them. And then, of course, the overlay of disadvantage. These are mothers who are above high school, mothers below high school, and you can see their relative risk of having a low reading score. And again, these emerging needs kids have a substantially worse outcome if disadvantage is layered on top. So their relative risk of having a poor reading score is much higher, as you can see here in this particular figure. So not only the kind of the whammy of having a emerging kind of developmental problem, but the double or maybe triple whammy of having disadvantage as well. And these are these policy opportunities that we have in those first 5 years of school, of life, and the first 3 years of school. And then finally, for us, we've had this added opportunity of embedding the EDI into our massive longitudinal study of Australia's children, which is our large cohort in Australia, where we've actually been able to embed it in this particular cohort here, which is the B cohort, the birth cohort. But actually in our kindergarten cohort, we were actually able to embed some of the EDI data. And that tells us a really rich story, and it tells us some of the power of putting the EDI into other data sets. And for those of you who work in this area, you'll know this power of linking data. So two really interesting parts of this story. This is looking at the trajectories of these children over time. And you can see the academic trajectories. This is the high, average, low, and very low trajectories of children with special, of children overall, sorry. And not surprisingly, you can see, and this is some really interesting work if you're interested in looking further at this, is children's trajectories are incredibly stable in our school system. This is the kind of tram tracking of basically where you start is where you continue. And then if we look at how these kids are doing on those trajectories, it won't surprise you to know if you look at the standard population, not the children with additional needs, and you look at the top 75%, you can see that in the top 75%, there is a higher proportion of children in the high trajectories, and in the lowest 25%, there is a high proportion of children in the low trajectory, but still some children in the high trajectory. So there are some protective factors. If we look at this group of children from this study, we can see probably what we were most surprised about was the enormous proportion of children in this group with these emerging needs who actually have the low trajectory. And in this group, we actually had, this was kind of extraordinary, and it is a smaller sample, but no children who were in the high trajectory if they were in the lowest 25% of children and had these emerging needs. So for us, this is an extraordinary policy opportunity to say how we're going to make a difference for these children. Then there's children with language background other than English. These are also a really interesting group of children, and we're interested in these children who are bilingual but are not yet proficient in English. And what we find is when we're looking at, this is looking at their NAPLAN score again in grade 3. And I just want to show you this particular group here. So these are a group of children who were not yet proficient in English by the time they got to 6 to 7. So this is this orange group here who are not yet proficient and bilingual and not yet proficient in English and actually English speaking. And what's interesting is this is a group of children who are probably learning disabled, but this orange bar here, this orange bar here is really interesting. And we think there's a group of children who don't speak English, but who teachers keep thinking they will actually catch up. So many bilingual children and or children who are not proficient at school entry will catch up, but there's a whole bunch of kids that are still not proficient at 6 and 7 who are probably language disabled, but never actually get anything done about that because they are not English speakers. So another policy opportunity about how do we actually think about the sorts of measures we need and the interventions that are important for children who appear to be just catching up, but are in fact language disabled. Another story is the preschool story. And in our EDI, we actually ask about the exposure of children to preschool. And what you can see here is looking at and so it's kind of like a little longitudinal study because we're looking retrospectively. So in the year before preschool, we asked teachers, in the year before school, did this child attend preschool? And what you can see here is this is the developmental vulnerability proportions. This is looking at low SES, middle and high SES. So not surprisingly, the higher SES children actually have lower forms of developmental vulnerability, and those who attended preschool did better than those who did not attend preschool. But, and that's good for everybody, low SES, high SES, but no convergence. So we've looked at interactions here and all the rest of it, no convergence. In other words, just attending preschool did not close the equity gap. So here's the other really important little lesson from the EDI in Australia that we wouldn't have had otherwise, which is if we don't take note of dose and quality in our preschool systems, we will simply perpetuate inequalities. And of course, the most powerful EDI story is equity and place. And just a reminder of what I'm talking about with equity, this is kind of what we're a bit obsessed about in Australia. Everybody should get an absolute fair go. But of course, if everybody gets the same fair go, you can see this kind of inequality of outcome. This is kind of what we want. Equity, we're actually able to live with the kind of flexibility. And I know Neil's been working a huge amount in this area. How do we actually deliver an equitable system for children? And this is reality. This is the sort of differences we see. And I always show this slide, and then one of the great things I can say is here are our actual results. So this is the proportion of children developmentally vulnerable on 2 or more domains of development in our poorest area compared to our richest area. So it's right here, right now in Australia, 3 times the difference. In a country we kind of pride ourselves on equality, but we don't really have it. 3 times the difference between the poorest and richest areas of Australia on children developmentally vulnerable on 2 or more domains, which is not so great, really. So equity is really a massive, I think, problem here in Australia. And just a reminder of what we mean by inequity. This is these systematic and, of course, the most important bit of this sentence, potentially remediable differences. So a kind of, I guess, call to arms of those of you who are around this virtual table about what are these remediable differences that we can make a difference to. And just how we've actually used the EDI to look at service inequities. Just so you know, this is Australia down here. I'm hoping you can see this. Australia actually wins. We're in the bottom third of the most unequal education systems in preschool, primary school, and secondary school. The US is up here. You guys aren't as bad, at least in secondary school. So it's never good when we're worse than the US. And so these are real challenges for Australia in terms of inequalities and the importance of using the EDI to keep shining a lens on that. But the other thing we've used the EDI for is to look at this mapping of services on top of EDI results. This is looking at the location of speech pathologists. These blue dots are private and the green are public. This is looking at our index of disadvantage. Red is bad, blue is good. And I think you'll probably all see that we have most of the speech pathologists in the areas that are rich and very few public speech pathologists. This is overlaying it with the EDI results and looking at language and cognitive skills. Red is bad, blue is good. And you can see we've got these big areas of red and yellow and orange, no speech pathologists, and all the speech pathologists in the areas where the children don't need speech pathology. And so another really important way of using the EDI to just show this kind of misdistribution of services. So it's not really about more, it's fundamentally about different. And then finally, geographic inequities, which is where the EDI, I think, absolutely shines, which is what is it about where you live that makes a difference for children and for child health and development. This is some work that Sally Brinkman and John Lynch did a little while ago. It was also, I just realised Catherine Law was involved with it as well. This is looking at these ends down the bottom here are the number of local communities that we have in Australia, or the number of communities, and local communities about 6,600, but this is looking at the interquartile range, looking at CEFA, which is again our index of disadvantage. And essentially, and I'm going to show many slides that just reinforce this, that we have this phenomenal geographic inequities. So you can see 5 is these are the least disadvantaged, the most disadvantaged communities, and the percent vulnerable on 1 or more domains of the AEDI. And you can just see the actual narrowing down here of the least disadvantaged, but the amount here of the poorest areas. So we just have this kind of social gradient, essentially, of our communities across Australia. And what the EDI allows us to do is look at this community variation map-wise. So when we said the EDI is putting children on the map, we literally have maps. And if you go into our Australian Early Development Census website, and in Australia, all of the data are public. And this has been a game changer in terms of raising the profile of the EDI for communities and for policymakers at all levels of government when the data are public. So you can type in the suburb that you live in and the map will come up, available for anybody in Australia. So this is looking, again, just looking at index of relative disadvantage. And the importance of looking at that is that, sorry, I'll just go back up again. You can see the variation of poverty. So dark is bad, light is good. Just in this one area, and just as Logan, and just remember the name Logan, I'm going to come back to that. It's an area in Queensland. But when we overlay the EDI results, so this is just looking at CEFA, this would be the traditional way one would look at a community. But when we, of course, overlay the EDI results and our other results, things look quite different. This is the percentage of children who attend a preschool program. So dark is bad, in other words, low percentages. And you can see Logan is not doing very well in percentage. You can see this thing here. This is actually the highway. So this is the equivalent of the wrong side of the tracks, really. You can see the split in this particular area, and you can see there hasn't been a huge amount of change over the 3 data collections. This is looking at the proportion of children developmentally vulnerable in the same area. And this kind of variegation of colour where you can start to see, hey, hang on, there are some areas doing better. Like this looked really bad on CEFA, but hang on, this is looking a bit different. This is the beauty of the EDI in suddenly saying, hang on, there are some areas of concentration of kids doing badly, but there are some interesting areas of change both over time and within an area that signal something different going on. And of course, that's even more so when we look at each of the actual domains. So physical health and well-being, social competence, emotional maturity. And now we're talking about a whole range of different variations that really would suggest that we need to be looking at what's going on, not only on developmental vulnerability, but also across the different areas of development. And again, language and cognitive skills. You recall the first slide, maybe we looked at preschool. These kids got to go to preschool. These kids did not go to preschool, and look at how it plays out in this huge predictor of how kids are going to do at school. So I want to just kind of circle right back now to the EDI as really a driver of creating data-driven and evidence-based early childhood system reform in Australia. So I've spoken to you about how it's really embedded in the policy environment. Now I want to talk to you about how it's embedded in the way we think about communities in a kind of increasing interest internationally in kind of place and local solutions as a driver of change. So this is a kind of way of looking at this kind of mud map of how we can create a data-driven and evidence-based approach to understanding and addressing inequities. And as I said, the fundamental interest we have, and we've been using the EDI for, is this idea of how do we actually address inequities. And so there are 5 kind of areas here, using improvement for change, the importance of relational practice, indicators to drive change, and then kind of this idea of stacking the existing, what we already know works, in a way that's likely to make a difference. And I want to particularly talk about this idea of indicators to drive change, and this idea of making bold decisions at an environmental level. And our view is that it's got to move both with and beyond incrementalism to really try and think about the communities that children live in. And so I want to just do a little brief dive into a study we've been doing called the Kids and Community Study, which is trying to look at how do we make a difference for kids, and what is it about where you live that makes the difference. And what I've got there is we have a national kind of journal, but it's really kind of very lay written, which is called the Conversation, in which we actually had this working out what makes a good community where young children can thrive. We've had a lot of interest in this. And what we set out to do, okay, we're doing so well. Here we go. And I just, I really want to highlight this. If collaboration is probably at the centre of the EDI, and it's been a really important vehicle for getting people around the table and having a conversation. And I put this up around the Kids and Community Study because I think it really highlights the importance of this. So we've got different universities, we've got different state governments, we've got health, and we've got education, and we've got international players. And this is the kind of work that the EDI is starting to generate. So I wouldn't necessarily recommend you having this many players in a project, particularly doing teleconferences with them, unless you really want to put your blood pressure up. However, these are the sorts of players that are going to make a difference. And what we did was set out to use the AEDC, as you can see here. So I'm going to flick over this slide. But we used, you recall when I was showing you those slides, that we had these odd areas of kids in one area where you had this light area, which is this what we've called off diagonal positive, where these are poor areas, but kids are doing well. And this compared to these on diagonal disadvantage, which are poor areas where kids are doing as expected. And it kind of brings up this question, what is it happening in these areas where kids are doing well, even though they're poor, and this kind of learning from extremes methodology. And then we embedded that in this kind of idea of, and you'll recognize this is this kind of ecological approach, but are there these environments? Do we need to kind of really expand our thinking in the early childhood area and not just have services, which are clearly important, but think about the built environment, the physical domain, the social environment and the social capital of a neighbourhood, governance, and then, of course, socioeconomics. And traditionally, we kind of spend a lot of time here thinking we can't do much, and a lot of time here, which is fundamentally important, but not much time elsewhere. And essentially, if we're going to make a difference for kids, we've got to be able to think about all of those domains, and we've got to think in a really big way. So this very large mixed method study, which I'm not going to talk a lot about because it will take a whole presentation and there's lots more to talk about, but we came up with what we've called a set of foundational community factors. That is, factors that lay the foundations of a good community for young children. And when we started this project, we didn't take anything off the table. So you can imagine sort of we're in this area, you kind of go, oh, housing, that's too difficult, let's take that off the table. Our built environment, that's too difficult, let's take that off the table. But we didn't take anything off the table. And so we came up with this set of differentiating foundational community factors. Those were actually associated with areas doing better. Now, I'm not going to spend a whole lot of time on this because Whitney and Neil will start winding me up. However, as you can see here, there are some really interesting factors, and this is the be bold. This is the communities galvanizing about bold decisions, things like housing affordability, housing tenure, public housing, housing density, stigma, communities where they are highly stigmatized, had really strong bonding social capital. So they kind of were moving inward, but really poor bridging social capital where they looked outward. Perceived school quality. So these are mixed methods. So hang on, we're moving away from single silver bullets to these kind of complex ways of thinking about making a difference for kids that are entirely about communities taking control. And then these important foundational community factors. As part of this project, we went and did interviews with families and stakeholders. We ended up with about 150 stakeholder interviews, and we thought, well, that's an enormous amount of qualitative work. And we asked, what do you think is important for young children? And here are the important foundational community factors, like having good quality parks, being close to nature and greenery, walkability. Now, if I said this to you, you wouldn't fall off your chair and go, really, people like nice areas to live in? The question is, how do we actually create communities that look like this and then measure change over time? So for those of you interested, the report of all our findings is available on the web. And for those of you who want to email me, we have a draft manual of how you actually collect these factors. So I've kind of left the best to last because the EDI has now generated an enormous amount of community interest. This is from the ADC website. And there are just on the ADC website 36 community stories that you can actually have a look at. And what we're finding is that we've got all of these communities that are starting to use the EDI to tell their own story. And we're in this extraordinary thousand flowers bloom sort of place, which I think has got extraordinary opportunity, but also interesting risk about the kind of spray, what I call the spray effect, where people are kind of spraying things across the community in the hope that it changes their EDI results. And I think that's, as I said, both the opportunity and the risk of the EDI in how do you garner this enormous amount of community interest where the EDI is just embedded in the way they're thinking. And you remember I talked about Logan before. Logan has millions of dollars going into it. It's an area of Queensland that's highly disadvantaged. And look what it has on their website, right up front and central. The ADC is absolutely driving their thinking. People sit around the table and talk about how we're going to make a difference to early childhood development. without the EDI, there is no possible way that we would have this generation of dialogue, this generation of understanding the importance of early childhood development. So, 2 last slides. The first is for those of you who are on the line. And I think it's this moving of us and using the EDI to move to a place where we haven't gone yet, but we really need to be thinking differently. And he says it is, and those of you who don't know, but John Berwick sort of led the whole healthcare improvement movement, particularly from the US, and was a game changer in the way that we run, particularly hospital healthcare. And he says it is the burden on good leadership to make the currently unthinkable thinkable, to question the obvious, to make the present systems unavailable as options for the future. The boundaries in our minds create fear about the consequences of crossing over to the undiscovered country. But the possibilities we really need do not lie on this side of our mental fences. And once crossed, these fences will look as foolish in retrospect as the belief of other times now often look to us. So a real call to arms. How do we think so differently, and how are we going to get there? And then my final slide, this beautiful Aboriginal child in Australia, and Gabriela Mistral, Nobel Prize winning poet from South America. And just a reminder to us all why we're even bothering to do all of this, our absolute commitment to children, a reminder about why the early years are important. Many things we need can wait, the child cannot. Now is the time his bones are being formed, his blood is being made, his mind is being developed. To him we cannot say tomorrow, his name is today. And I'll end there. I do have a last slide with all the details of the website, etc., but it's not as much fun as this slide. So I think now I hand over to Neil and Whitney.
Thanks very much, Sharon. That was terrific to hear the full story of all that's going on in Australia and how the EDI has been this game changer. It really resonates with our experience here, not quite as expansive. We have in the U.S. we've done about a little over 300,000 children in a whole of a variety of different communities. But that way in which you talk about, I sometimes say that the EDI is like a gateway drug for communities in the sense that it really changes their mindset and the way that they think about themselves and their children in a way, and that the kids go from being invisible to actually being able to see what's going on, and it really motivates a change in expectation and focus in communities. And it's interesting to see that it's exactly the same kind of thing that's happening in Australia. Let's open it up for people's comments or questions. We have a first one.
This one is from Sherry Pruitt. Are there examples of communities in the U.S. using the EDI?
Oh, well, I guess that there are lots of examples of communities in the U.S. using the EDI. There are most of the cities and communities in Orange County, California, using the EDI. Many places in Los Angeles, including Pasadena and Santa Monica as cities, but lots of other parts of Los Angeles. Washington, D.C. is using the EDI and has mapped the EDI to the entire city and has used it for a whole variety of educational changes. And in the last webinar, we had representatives from San Antonio and Hartford and several other places that talked about what they're doing with the EDI in all those places. So I would refer you to the LCRN website, to the last webinar that Lisa Stanley and I presented last time.
Okay, our next question is from Ariana Oliva. How is the collection of the EDI funded in Australia?
I want to just add on to that, Sharon. How much does it cost to do the EDI for the whole country now?
Okay, so it's a really interesting question, and there's kind of some components to it. So there's different components. So obviously there's the funding of the machinery behind the EDI. So the data collection platform, the Social Research Centre here, which is the kind of data collection agency. So there's the funding of the machinery behind the EDI, and then there's the funding of the per teacher time. The funding of the per teacher time is, I think, around about 24 million. I can't tell you these days how much it is for the machinery behind, but I think it's around, around about 3 to 4 million. So when we first started, the budget was around 34 million, which was around, and it's come down a little bit through to efficiencies and stuff like that. And so that 34 million per cycle was around about the cost when we start. So it's come down a little bit because of efficiencies, but that's essentially every time they go out and do a data collection, that's the kind of figures we're sort of talking about. And at the moment, our federal government pays for all of that. And the states and territory kind of contribution is the in-kind contribution. There's a coordinator in each state and territory that makes sure all the schools come on board. So we have this really high completion rate, which is an exercise in and of itself.
This is very helpful, Sharon, because we've been asked a couple times during the Obama administration, right at the tail end, we actually got a request to ask what would it cost to do the EDI for the entire United States. They were actually thinking about that. And even we've been thinking within California, if we could sort of be able to sort of say what it would cost here. So having a sense of what it costs there is very useful.
Yeah, I mean, the biggest cost of that, sorry, go on now.
That you're paying the teachers to do it. And again, here in the United States, in many places, in some places the teachers are being paid to do it, in other places they're not.
So in Australia, we have a very strong teacher union, and there was no possible way we could do the EDI without having money on the table. It's not actually paying the teachers, it's paying backfill so the teachers can take the time. It takes about 20 minutes per survey. So that's been really important to get the teachers on board. There was just no possible way in Australia it would happen without that.
Yeah, this is Lisa. Hi, Sharon. That's very true for what we're finding in the U.S., that it's teachers doing it on their own time with an hourly stipend according to union regulations or sub-release time. The other kind of promising practice we found is that some school districts who have professional training days already allocated, they actually see the EDI as an excellent topic for early development, school transition, and so they'll allocate that day, which really does help to bring down some of the costs in some cases, in some places.
Yeah, that's the major cost. The infrastructure is actually relatively cheap because once you've actually set up the digital system, there is some costs, or obviously maintaining it and cleaning the data, et cetera, but actually that's not the cost. The cost is the teacher backfill time.
So our next question is there any overlap between the AEDI and the Australian National Development Index?
And who asked
that? So I'm not sure what the Australian National Development Index is. So there is various terms for the EDI. So there's the Australian Early Development Index, and that is the EDI. The Australian Early Development Census, and that is the EDI. The Australian National Development Index, I'm not actually sure what that is.
I have a clarification actually. So it says, are there any plans to integrate the EDI in the Australian National Development Index, ANDI? I don't know if that helps at all.
Oh, Andy. This is funny, isn't it? Yes. So I'm involved with the ANDI. So that's being driven actually sort of as a result of Canadian work. Those of you who are Canadian on the line. So this idea of kind of creating an index, and I know Neil, you've been involved with kind of a similar sort of approach, kind of with the alternate to GDP, and what does that sort of look like? The work that's being done around the ANDI is very preliminary, but it's trying to move to this idea of well-being of a country and how do you actually create metrics that drive us away from the traditional metrics. So That's what the ANDI's doing. And yes, the AEDI, sorry, I got confused. The Australian Early Development Index will be part of the Australian National Development Index for sure.
That's something we should also be talking about, because we are in the process working with the Robert Wood Johnson Foundation, RAND, and others to build what we're calling the GDP2, but it's a sort of measure of human potential. And we've been looking at the EDI as a kind of proxy measure right now, because we don't have a lot of human potential development or capability development measures here. And so that was going to be one of my other questions. Most of this has been driven by the early childhood school readiness focus nationally. Is there more of a shift in Australia to the kind of sustainable development goals, well-being of the population kind of framing? Is that going on there?
Kind of. I mean, I think what's been really interesting is the movement of the EDI from what was fundamentally owned by early childhood. And I don't know about your countries, but in Australia, early childhood is still a pretty small player in the kind of policy area. Into what's been interesting is schools have taken it on. And that's been if you think about kind of leaps in terms of, and jumps in terms of the influence of the EDI, as you can imagine, it's kind of moving along, making that a difference to early childhood. And then we've got this massive leap where it's now fundamentally in the purview of schools. So schools are now thinking much more about the early years and have really embraced it. In fact, I just spoke around early childhood and the EDI to Queensland principals, and I had a complete packed room of people interested in early childhood. That would not have happened probably 5 or 6 years ago. And so we've had this kind of leap of this embracing of early childhood into the schools. And you already saw it's embedded in the policy environment. A broader question is this idea of driving it towards the broader kind of economic environment and the broader social policy environment. That's slower, not because of the EDI, just because Australia itself is slower in embracing this whole well-being phenomena. The sustainability goals don't have a huge amount of cachet in Australia, unfortunately. And so that for us, I think, is going to be a much slower piece of work in Australia.
I'm curious also, Sharon, has there been much interest or focus of moving with the MDI at all, or has that been trialed at all in Australia? And just for people listening, we'll be talking about the MDI in the next webinar. It's the Middle Development Inventory developed at the University of British Columbia. It's a population level survey like the EDI, self-reported by 4th graders and 7th graders about their thought, feelings, and experiences, and gives children a voice and covers many of the same domains. So it allows for sort of population trajectories beyond just the 5-year-olds or kindergartners. But I'm curious, is that something that has started to move there at all?
It has, and there are some areas that are doing it. There has certainly not been whole-scale take-up. And I think I mentioned earlier in my presentation, the EDI happened because it was a point of time. And as we all know, there's kind of sometimes you need this kind of perfect storm of policy. At the time, it was policy interest, political interest in an election. And that's how we got it up. I don't think we will get it up now. And so the MDI is subject to some of these political and policy vagaries that we all kind of operate within, which is no one's kind of taken it on in any major way. So there are certainly areas of Victoria and South Australia that are trialling it, but no major take-up. I think part of it is also people are still trying to even deal with the EDI. So it's kind of like, in some ways, almost kind of death by data. There's a sense that people are feeling that there is a lot of data flying around at the moment. How do we actually make sense of this? And how do we really start joining the dots between data production, data reporting and then actually our response to all of those data, and then seeing a kind of causal pathway in that. And so I think people are still not struggling, but trying to make sense of all that, even with the EDI. So we haven't seen MDI take off, but it's certainly at the process. The process at the moment is kind of more feasibility testing. And there's also some interest in the TDI, which is even more kind of challenging because it's kind of sits in a weird place in our system and sort of replicates some of the stuff we already do. But sort of trying once again to create these population trajectories. And I think the challenge is really to start, and I think for many of you on the line maybe, is trying to think about how do we start more formally focusing and bringing this nexus of making what we're doing to make a difference and the data together in a kind of meaningful way, particularly for communities in this increasing interest in place. So if we're using place as the vehicle, how do we use these data to really accelerate change so we're not all sitting around the table in 10 years' time talking about the EDI but haven't really fundamentally made a difference?
Our next question is from Jen Russell. So how does the Australian EDI fare for children from Indigenous or minority ethnic communities? Are they unduly disadvantaged on some measures due to, e.g., ESOL? Was it validated for use in these communities?
Yes and yes. So when we did the original piece of work, we were really did a lot of work around making sure this made sense for Aboriginal children. So there's a few things that were put in place. First of all, we actually did some testing to see whether there was a fundamental bias against Aboriginal children, because this is teacher report. So we did some work doing that, and that's actually on the AEDC website if you want to have a look at that report. So that was the first thing. So we're really interested in making sure that there was a cultural adaptation. The second thing was we actually have cultural coordinators. So the aim is that in any school that's got significant Aboriginal children, there is actually someone nominated to work with the teachers to make sure there isn't undue systematic bias of the way teachers are actually reporting on Aboriginal children. And we have a kind of online training that teachers do before they complete the EDI. So we're trying to make sure there isn't systematic bias in the way that children are being reported on. And the third thing was there's been a lot of engagement with local Aboriginal associations and peaks to make sure that there was a level of comfort about the way Aboriginal children were being reported on and the sort of questions that were being asked of Aboriginal children. There are some specific questions of Aboriginal children that are embedded in the actual survey itself so that we get some additional information. So this makes all of these things together, while not perfect, are a pretty good group of risk mitigation strategies so that we can actually know. And as you can see, we've got 4 to 5% of our population is Aboriginal children, which is probably the highest number of Aboriginal children in any survey. What's been more challenging is how those data get reported, and there's an increasing interest in Australia, an increasing desire to work with Aboriginal people in the way data get reported and thinking about data governance, and that's probably the area that's becoming increasingly challenging to think about how we actually report on Aboriginal children and who actually owns the data and data custodianship.
Great. I wanted to ask you one other question about the KICS data, and how are you now using that data to really change? How does that change your thinking about your whole approach? Because you were looking at issues that were off diagonal, places that were doing better or worse, and you ended up with a lot of, all these different categories. And does that sort of lead you back just to the ecological model once again, so that we have to think about everything all the time? Because nothing really comes jumping out, or are there other sort of lessons that you talk about that come out of the KICS study that are really influencing how you're thinking about issues of equity and community and where the leverage points might be in communities?
I think it's a really good question, and like all of these areas, and I just don't think we can move away from this idea that, you know, there's this, you know, saying for every complex problem, there's a simple solution, and it's wrong. And this is couldn't be more true with this. So I think if we're looking for, like we were hoping we would find, here's the 3 things that systematically predict for children doing better in these better areas, and just do these 3 things and we'll and the world will be a better place. But of course it's not like that at all. And in fact, the reason we're heading down these kind of local, place-based, local solution pathways is because it is the very complexity and the richness of being able to do it at the local level that means that national and state policy solutions often don't cut it. So that what KICS has told us is that it is that complexity that we have to embrace, and that if we don't embrace that complexity and keep looking for these kind of single interventions, we're likely to get it wrong. And what's interesting is when we talk to people about KICS, we've had a couple of communities just take it on board, and when they look at their results, they can already see some areas that they might be able to focus on. So whilst this gives people a set of these factors, and the importance of qualitative data in this I can't emphasize more, because if we just rely on quant data, we don't really get the proper colour and movement of how communities thinking. But really then it's the kind of tool really in terms of, and it's the kind of stuff you're trying to do, Neil, with All Children Thrive, is how do you engage the community around these things, and for them to start making some decisions about where the effort's going to be and what it kind of means for them. So it's just understanding where there are local efforts that are important, but you kind of don't want to take your foot off the other policy questions around housing, for example. And so for us, it's like, how can we sort of put this in front of advocacy groups about the importance of some of the housing issues, and also try and really finesse some of the built environment measures. I think the built environment is an incredibly underutilised vehicle for us in early childhood, and it's a really concrete way of communities starting to think about what they can change. And this is the kind of be bold stuff. And we've got communities like Logan are starting to think about, well, you know, we've got this, you know, saying things like, well, you've got this crappy community centre, why don't you knock it down and build a new one where people live, and then use that piece of land to build mixed social housing. This is the sort of stuff we really want communities to start thinking about. It's moving from tiny little projects where you sort of, you know, that's all very lovely to create fertile ground for communities, but the game changers have got to be in this thinking about, it's not really the ecological model per se, although the narrative behind it is, but it's at that community level. What are the kind of big hitting things that might start to make a difference? And I think the built environment is kind of really underutilised. Not surprisingly, the built environment and the social environment are mixed. And we went out there was really interesting things like people empower the community to make some decisions about how a community centre was being built, and it was beautiful, and then that created a kind of social community. So it won't surprise you to know that the built and social environments and governance are all intermingled. But the challenge, I think, is working out what's going to be put at a community level, and what do we still need to do advocacy-wise in terms of state and national policy. So I think the way forward, and I know you've been thinking about this as well, is how do we give communities the precision they need, and then how do we give policymakers the different sort of precision they need to be able to make the right decisions at the right time and spend dollars wisely.
Yeah, I think that that's really important. And I think that there's an interesting discourse that's emerging here in the U.S. just in the last few months. And part of that's being championed by some of the social commentators, Tom Friedman in the New York Times and David Brooks at the New York Times, that are both really focused on communities and the role of communities and social capital in communities, and sort of what both is at stake and how challenging that is right now. There's a recent book by a guy named Raghu Rajan, R-A-J-A-N, called How Markets and the State Leave Communities Behind. It's former IMF chief economist and professor at the University of Chicago Booth School. His solutions aren't great, but his analysis of sort of how the markets in our society dominate the state and how that then dominates communities, and what's happening to communities throughout the United States is very, very perceptive. And he's really talking about how do you begin to think about policies that rebalance what's been really a extraction of social and human capital for many communities. And that's why we're seeing an opioid epidemic and various other markers of despair, because communities haven't either been privileged or resourced in the right way. And, you know, what the EDI is really showing us is a pretty sensitive indicator of, you know, how children are doing, sort of the classic canary in the coal mine kind of issue. So, but I think coming up with these kinds of community solutions and both local solutions that can be scaled up or spread, but also starting to think about really what kinds of really fundamental changes of policy are going to be necessary to really change what's going on in many of the local communities. One of the things that Rajan talks about is what happens when in local communities across the United States where you have banks in the local community that give loans to families. When the bank was a local bank and the people and the bankers knew the community and knew the people, banks would make loans based on the people that they know and certain criteria. Now the banks are all run by multinational companies and the criteria are all set, and it makes a distance, and it's just sort of an example, same way that factories now or other workplaces are now owned by multinational companies, and they aren't sort of controlled by or have much allegiance to local communities. So there are a whole variety of things that we need to be thinking about in terms of the economics and state policy that has to do with sort of allowing communities in our country and cities to, you know, have a break and not be sort of just at the butt end of, you know, this massive economic change that's going on at present. So anyway, I'm getting off the EDI here, but I
if I could
suggest
bring
that.
back to the EDI for a minute, one of the challenges that sits in the middle between that sort of narrative and what local communities are doing is that the EDI has generated a huge amount of effort. But I think part of the challenges and one of the reasons we developed KICS and the metrics is that it kind of generates a huge amount of effort, but not a huge amount of direction. And I think one of our challenges in trying to create KICS was trying to create metrics that drive change, so that if you can imagine, you've got a series of metrics at each level, the child level, the family level, and the service level, and the environment level, that are sort of converging to drive change, of which the timelines for each are quite different. So you want kind of quick time change metrics around process, around the kind of infrastructure in a community, right through to things like the EDI, which is actually quite a slow moving metric. And I'm not sure we kind of conveyed that message strongly enough, so that one of our challenges has been communicating this idea of a population level measure. So for example, people are doing small programs in libraries and then looking for EDI change, which of course isn't going to happen. So you know, I think we have to be careful that we don't have a kind of uber narrative that communities can't make sense of and don't provide them the metrics to sort of guide their effort. So you kind of need both, that ability to create the larger narrative, the ability to stimulate policymakers in thinking about it, but also the metrics that will provide communities with what they need to say, hey, we're heading in the right direction. And as a complement to that, there's some work going on here looking at how do you actually change the Australian public services thinking about local solutions, and how do you train them to start thinking about how they're delivering what they're doing from a policy point of view and allow for local governance. Now, if that gets pulled off, that will be a game changer here, because part of the reason we can't do a lot in the community is because of these kind of artificial governance systems in the way we kind of pipeline services, pipeline programs and pipeline funding, which is totally fragmented, siloed, and not designed to empower local communities. So keep an eye on that, but that's been really interesting in terms of, rather than saying, hey, you need to change policy, it's actually saying, hey, you need to change yourselves.
Yeah, is there a website or a group that's actually leading that if we wanted to know more about that, you know, sort of local solution empowerment framing?
Yeah, so there's a piece of work that's been done through the Australian New Zealand School of Government. It's not public yet, but when it is, I'll send it through to you. But they're actually being asked to help. So the Australian New Zealand School of Government actually does a lot of the policymaker kind of support training fellowship. And so they're doing a lot in this space. So it's certainly watch this space.
Great. Okay. If there aren't any other chat questions, do we see anything else on the chat? Because Sharon and I could talk for hours, which we do when we see each other. So it's good to catch up. And but I think at this point, we're going to bid Sharon adieu and thank her just enormously for spending the time with us today and sharing her experience and wisdom about the work that they've done there in Australia. And we're come to the end today of our webinar. I want to thank all of you who joined us today. And as I mentioned earlier, this webinar has been recorded and will be made available on the resource page of the LCRN website. That's www.lcrn.net. And as I also mentioned, next month, either at the end of April, beginning of May, we'll have a presentation about the MDI and how it's being used in Canada, mostly in British Columbia. And that'll be the fourth in our series of the measurement website series. So again, thanks everybody, and hopefully you'll be able to join us next time. And please tell your friends about the availability of this webinar and others on the website. Thanks so much.
Thanks, everybody.